Welcome back to Cancer Buzz. I'm your host, Summer Johnson. In this mini episode, ACCC's President, Krista Nelson, on the experience of working in healthcare today and the emotional toll that COVID-19 continues to have on the cancer care team. Krista Nelson is an oncology social worker, and she's the program manager of quality and research at the Providence Cancer Institute in Portland, Oregon. When her term as ACCC's 2021-22 president began this spring, she laid out her president's theme, titled Real-World Lessons from COVID-19, Driving Oncology Care Forward. Her three key priorities include solutions for health equity, the increased need for psychosocial and supportive care services, and supporting the professional well-being and resilience for the multidisciplinary cancer team. Krista's been leading discussions in her cancer center on the realities and the toll this pandemic is still taking on cancer care.
Our hospital, I've just been so lucky to work with a team where we're recognizing the impact of COVID and sort of that really realization that we are not done with COVID or not on the other side of the pandemic. And our hospital has had an opportunity to involve caregivers across the community, all caregivers, so providers, physical therapists, MAs, to join and have discussions around issues of loss, grief, forgiveness, even self-compassion. And another way that our hospital is supporting caregivers is we've continued to hold Schwartz rounds, which is an intervention by the Schwartz Center for Compassion. And we've been holding those virtually throughout the entire pandemic. They typically have been around a case, and what we've really found is they're really around the emotional impact of what our caregivers are going through. It's an opportunity where we're really allowing our caregivers to speak their authentic truth and to talk about the impact for them personally, for them, their families, and to really be in a safe space where there's no judgment. People are hesitant right now. They don't want to offend people. They have a lot at stake. And so it's really just creating a space where people can talk about the emotional impact and feel supported by their colleagues.
What about that emotional impact? It feels so different when you turn on the news and you look at what was supposed to be the summer of joy for the rest of Americans, but it's a different story inside our cancer care centers.
Yeah, I think that statement particular, I think President Biden came out in June and said, this is a summer of joy. We have this vaccine. And although in the medical setting, we're feeling relieved and so grateful to science that we do have this vaccine, I think we also have just this sense of exhaustion, this loss. And I think specifically, we still have hospitals full of people with COVID. And I think the vaccine hesitancy is triggering for some people making choices that are different than they would make. And what I'm really hearing from people is this division of community. So looking at sort of how I am as a caregiver, why I went into medicine, I love to connect with people. I'm wanting to connect with patients, their families. And, when we do these screenings now for people even to come into the hospital, have you had a vaccine? What people are sharing is their awareness of a bias that comes up, that they've almost put up an emotional wall between them and the people that they're caring. And how do we still find our compassion? How do we still connect with those loved ones of our patients that are dying? And it's been the whole gamut. I mean, we've had providers yesterday in tears sharing their sense of grief for the families, the fear of their own health and their families. They have young children who aren't vaccinated. And also the heartbreak of the families. I think sitting with them, we have families we support at end of life, and the family members are saying, I just want you to know we're all vaccinated. So it's just really created this division, and really trying to acknowledge it and still be the compassionate caregiver you want to be. People are really struggling.
This dovetails right into one of the key focuses of your presidential theme, Krista, which is building supportive cultures and resiliency for the cancer care professional. What are some of those things that you're hoping to implement this year?
Yeah, I think even just the opportunity to talk about it with other caregivers, I think having a space to consider, wow, we take care of patients who make choices that are different than ours all the time. We've been doing this for years. Patients who may choose to not do chemotherapy, not do palliative care, and we support them regardless of their choice. Patients that have drug use issues, we support them and don't feel that wall. What is different now? And asking people to really consider, what is it that's different about taking care of someone who won't get a vaccine or someone who doesn't believe that the pandemic is real? And I think at the core of that comes the fear of our own personal safety and, the fact that someone else's decision impacts us personally and our families. So one of the interventions I think that is so important is just providing the space, having these discussions in a safe, facilitated way for people to share the emotional impact of this care and know that they're not alone in it. Sharing in a group of people, 50 people, even if it's online, knowing you're not alone with these feelings. A lot of people may have never admitted out loud that they felt like there was a wall up between them and their patients. That's not what we do as healthcare providers. Other interventions, I think, are mindful pauses, giving yourself a break to practice some mindfulness. Burnout is just rampant right now. And it's sad because I think it was hard before COVID. And now after the pandemic, at least in my practice, and I'll share again, this is my experience, it feels even harder right now. And so I think there is no right answer, but the important thing is to keep having the discussion and to not ignore it, but to acknowledge it and try to do things differently. And I think at the core of that is connection. So finding ways to connect, even if it's virtually, with people who may have some of the same emotional experience that you do.
You can go to the ACCC website for more details on Krista's initiatives, and you can check out our episode of Cancer Buzz TV with Krista for a more in-depth discussion of these priorities and the ACCC programming that's already underway. You can find that by searching for Cancer Buzz TV on Apple Podcasts. Also, did you know that Krista launched a monthly video Mindfulness Meditation Series for cancer care professionals? That's on the ACCC website as well. Until next time, for the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.